Tonight in Medical Rounds, it is a very common condition affecting a lot of women. We're talking about urinary incontinence, yet many women choose to live with it for fear of treatment and also because it can be embarrassing. But our guest tonight is here to tell us that there are effective ways to treat it and women should not fear it. Joining us live is Collen Mellen, an APRN in the Urogynecology Division at Hartford Healthcare. Collen, thanks so much for being here.
Good evening.
So first off, just how common is urinary incontinence in women? What are the numbers we're looking at here?
It's a very common condition. Bladder control problems affect 30 to 50% of women. It's twice as common in women as it is in men. Rates of urinary incontinence increase with age, but are not a normal part of the aging process.
Now, Collen, are there actually different types of urinary incontinence?
There are. The two most common types are stress urinary incontinence, affecting 1 out of 3 women over the age of 45. This leakage occurs with strenuous activities such as coughing, laughing, sneezing, and high-impact exercise. Urge urinary incontinence affects 15% of women over the lifespan and increases with age. It occurs with a strong sense of urgency and the inability to get to the bathroom without urine leakage.
I know
Mixed urinary. Oh, go ahead.
Yeah, we were going to say, we talked about this a little earlier, that it can be an embarrassing condition. Is that one of the reasons why women just really choose to live with it?
Yes, some women think that it is a normal part of the aging process and don't ask for help. Others are too embarrassed to discuss it with their healthcare provider. Some fear that there are no effective treatments, and others are fearful that surgery might be the only option.
And there is help for women. We want them to know, with urinary incontinence, what are the potential treatment options out there?
Yes, there's a full range of safe and effective treatments. Treatments are tailored to each woman's personal bladder control problem and her goals for treatment. 80 to 90% of women who seek care will find that they have improvement in their symptoms.
I also want to mention there is a free upcoming educational class that is happening tomorrow. For those looking to go, what can they expect?
Yes, urogynecologist Dr. Anna Pilzek will present a program on female urinary incontinence. She'll talk about the types and causes, treatment options, and she'll hold an open question and answer session.
All right, sounds good. Collen Mellen, APRN at Hartford Healthcare, thank you so much for your insight. We appreciate it. I also want to mention again that free educational class called Urinary Incontinence in Women. It's going to be held tomorrow, February 27th at 6:30 p.m. in Glastonbury. To register, call the number on your screen, 1-855-HHC here. In the meantime, the conversation continues with Collen in a live interview on the Hartford Hospital Facebook page. She is available right now to answer your questions.